Welcome to the Journal of Graduate Medical Education's Spotlight on Authors. I'm Dr. Tom Cooney, an Associate Editor at the Journal of Graduate Medical Education and Professor of Medicine and Vice Chair for Education at the Oregon Health Sciences University. The goal of this journal feature is to bring our readers some of the backstory regarding papers that we publish in the Journal of Graduate Medical Education. Today, I will be interviewing Dr. Roger Bush, the founding internal medicine residency program director at the Billings Clinic in Montana and clinical professor of medicine at the University of Washington School of Medicine. The title of his paper is called Establishing the First Residency Program in a New Sponsoring Institution, Addressing Regional Physician Workforce Needs, which is published in the December 2016 Journal of Graduate Medical Education. Dr. Bush, welcome, and a special thanks both to you and to your colleagues, Dr. Dick LeBlond and Dr. Bob Ficalora, for your very interesting paper. What I'd like to do is to ask a series of questions, and my first question to you is, Dr. Bush, from a personal and from a professional perspective, what led you to move to a state where you weren't living and start a new residency program in a new sponsoring institution?
Thanks, Tom. Personally, Montana is not a new state for me, as I grew up in northeastern Montana. After practicing general internal medicine, first in Oregon and then in Seattle, I became a clinician educator and a program director. And the opportunity arose to go back to Montana and contribute to the workforce in this vast, underserved rural area. Professionally, it was a great opportunity as well to work in an excellent clinical delivery organization and be able to build a program from scratch with an initial design strategy to try to get it right from the start.
Dr. Bush, my second question for you is, what are the implications of your findings for other institutions who might consider becoming new sponsors of GME and starting new residency programs?
Yeah, well, there's a lot in there that allows a new program to put together a plan. When we set out to start our program, we had essentially no roadmap. There was no published literature and hardly anybody to talk to who had set up a program in a new organization. I think the paper gives folks some idea of where the shoals and the safe harbors are to build a program, and gives them kind of a checklist of issues to go through to try to get it right before they actually have the residents show up.
Finally, Dr. Bush, what are the implications for your findings for residency program directors and residents at new institutions sponsoring graduate medical education?
Well, for residents, it's a wonderful opportunity to go to a new program where you can actually be in on the ground floor of building a new care system and participating as an innovator and essentially as a pioneer in building a new model of care, and then building the curriculum and the learning program around it. So for the right resident, these are great opportunities. For our program, we needed people that were interested in becoming general internists, interested in the region, because our mission was to bring general internists to the region. And folks that had the courage and the drive to to participate in inventing it themselves. For program directors, similarly, it's a chance to kind of escape the constraints of a traditional teaching hospital and work in a new environment. An apt metaphor for eastern Montana would be the prairie metaphor, where we were breaking sod. We were tilling land that had not been tilled before. Whereas program directors often find themselves dealing with policies that are decades or 50 years old. And trying to change something in a large, complex institution can be very difficult. So both for the residents and for the program directors, it's a great opportunity to innovate and to participate in healthcare reform at a really timely juncture.
Thank you for discussing your paper with us, Dr. Bush. I'm sure it will be very valuable to any organization or other group of educators who are considering starting a new GME program, particularly in areas with physician shortages. This concludes our spotlight on authors for December 2016, and I hope you will read this very interesting and insightful paper.
Thanks, Tom.